Okay, good afternoon, everybody. Dr. Michael Jacobs there at the Fertility and IVF Center in Miami with our Monday afternoon Instagram chat. Today's topic is how do I best get pregnant on a natural cycle? And this is good for people just beginning to start out the fertility process of how to best time things so that I can get pregnant in a quick manner. For patients that are in between cycles of treatment and want to maximize their natural ability to get pregnant without any fertility drugs and so forth. So how do we do this? We know that to get pregnant we need sperm getting to the eggs, and for that embryo, if it forms, to migrate from the fallopian tube where fertilization takes place to implant in the uterine cavity. The things that we need to realize is that, an egg ovulates in the middle of the cycle, and we'll get to how do we predict that. And once the egg is ovulated, it's really only capable of being fertilized for a 12 to 24 hour period. So if we don't get sperm to the egg at the correct time, it's going to be much more difficult for someone to get pregnant than if we get the timing correctly. The second aspect of that is how long does the sperm live? And most sperm, after ejaculation, probably, again, 12 to 24 hours is reasonable. But once you get beyond that, you have less and less sperm surviving. And we've had, the Guinness Book of Records is probably 5 or 7 days from the time of ovulation. But in general, sperm are good for around 24 hours. So if we've got an egg that's good for 12 to 24 hours and sperm that's good for, let's say, 24 hours, it's obvious that we've got to get the two together at the right time. If you ovulate on Wednesday and you only have sex on Saturday, it's going to be tough to get pregnant, and so forth. So how do we figure out when is the most fertile period and so forth? Obviously, if we're on a fertility treatment cycle with fertility drugs and HCG trigger of ovulation, and we're timing inseminations or timing run to have relations, that's easy. And we know that ovulation will usually occur between 36 and 40 hours after the onset of the LH surge. So in cycles that we're treating couples, it becomes a little easier to predict when that window is going to be, because we're taking somebody who doesn't as yet have an LH surge, and we're giving you what's called an ovulation trigger in the form of HCG, which simulates LH secretion from the pituitary and tells the ovary to ovulate. So when we're doing things in a more orchestrated manner, it's pretty easy for us to predict when ovulation is going to occur. If you're doing things on your own, it's a little more complicated because not everybody ovulates at exactly the same time. Usually you'll ovulate about 12 to 14 days prior to the next period, but the proliferative phase, the first part of the cycle, can be quite irregular sometimes, so that counting days forward is more difficult than counting days backwards. But if you count days backwards from the next period, you're already past ovulation, so it doesn't help you. So most of the apps that you have that you get online that are menstrual trackers and predictors of ovulation are doing pretty much just averaging out your cycle lengths and using an algorithm to figure out on average that you can ovulate, and your most fertile period is going to be about 13 days prior to your next period. It's calculating out what they think is your fertile window and so forth. So an app really is no better than just tracking your own cycle length and subtracting 13 days from the average of the last few cycles, and that's the most likely day that you're going to ovulate. To time things naturally, the best home way of doing that is going to be to use a combination of an ovulation kit and a basal body temperature chart. And you can get as simple as you like or as complicated as you like. If we know sperm is good for 24 hours basically, and you're not using anything at all, the key is, okay, if you have a 28-day cycle, you're going to ovulate day 14 or 15 probably, let's say day 15 of the cycle. And so if you have sex every other day in the middle of the cycle, like day 13, 15, 17, odds are you're going to hit it. If you want to get a little more accurate, we can use an ovulation predictor kits. And ovulation predictor kits are these pee-on-a-stick kits where you are checking your urine for the presence of LH predominantly, and that's the hormone that stimulates the ovary to ovulate. It's the ovulation trigger, basically. And most of the time, if you start testing, if let's say you have a roughly 28-day cycle, you start testing on day 12 of the cycle, somewhere between day 12 and 17, you're going to see a color change. It's going to be equal to the reference spot, and that's going to be your peak fertile day. If you're using one of these electronic monitors, it's basically taking the combination of your menstrual history and your ovulation predictor kit and placing it into an algorithm to figure out what's your most fertile day. And a lot of times they give you a entering the fertile period, leaving the fertile period, peak fertility day, and so you've got your fertile period, which is of over a 3-day window, and your peak day of fertility, which is the day of ovulation. But in general, if you're using an ovulation predictor kit, whether it's a smiley face or most fertile day, or just looking at the stick and seeing if it's equal in color to the reference spot, the key is that the day of the cycle that you're getting a urine test that's positive for the LH surge, the dark color change on the urine test kit. That's the most likely day that you're going to ovulate, either that day or possibly the next day. So the best advice if you're using an ovulation predictor kit is to have relations the day of the color change and the next day. So it doesn't matter what day of the week it is, doesn't matter what day of your cycle it is, but the day of positive LH surge and the next day are going to give you the best chances of getting pregnant in that cycle. If you're not using an ovulation predictor kit, my best advice is to have sex every other day in the middle of the cycle. If you are using an ovulation predictor kit, then I modify that to having relations the day of the color change and the next day. If you're using a basal body temperature chart, that's sort of a retrospective view of ovulation, in that once you ovulate and you start producing progesterone, your basal body temperature will go up a little bit. So if you're mapping your temperature day by day on a little graph or on your app or whatever it might be, you'll notice that somewhere around day 15, 16, 17, you'll notice that the temperature go up, and then the set point will rise by 0.5 to 1 degrees Fahrenheit. And once you see that elevation in the temperature chart, that confirms that you're already past ovulation. So the BBT chart, the temperature chart, is very good to tell you when the fertile window is passed, but it's not very good at telling you when it's coming. It just tells you it hasn't happened yet because the temperature hasn't risen and stayed elevated. So if you combine the two, if you combine the urine ovulation predictor kit and a temperature chart, the urine ovulation predictor kit is going to tell you you're entering the fertile period, and that's when you want to have relations. And if you have relations once a day during that interval, that's terrific. And then once the temperature goes up, it's telling you you're already past the fertile period. And you can do whatever you want before and after those periods of time. But the key to getting pregnant, the key to maximizing your fertility, is understanding when ovulation is taking place. If you're using just an app or past menstrual cycle lengths, assume you're going to ovulate roughly about 14 days prior to the next period. If you're using an ovulation predictor kit, the day of the color change and the next day are the two most fertile days. If you have had relations during that period of time and you go 2 weeks and you still haven't gotten your period, that's a good time to do a pregnancy test. And you can do a urine home test, is fine. If it's positive, then please notify us or your OBGYN, and then you should have a blood test to confirm it, and they can order any other additional tests that they think might be relevant for your particular case. So the key to understanding how to best get pregnant on a natural cycle is just understanding how your cycle intervals are, identifying when ovulation is occurring, and maximizing your coital exposure at the fertile window in the middle of the cycle. So I hope that's helpful for you today. If you're having very irregular cycles, if you're not able to predict an ovulation predictor kit, because some people have regular cycles but don't have color changes, then please let us know, because that means that you need some additional help. That means there's something else going on that's maybe preventing ovulation from occurring normally. So using these techniques is helpful to maximize things. It's also useful for instructing you as to when to ask for some help, because otherwise you might not get pregnant that quickly. So have a good afternoon. I hope that it's short and sweet and helpful for you all, and have a great day. Bye-bye.